Hey everyone, Boris, your host here, introducing the episode with Dr. LeGrand. This one is super exciting because he is a doctor that helps entrepreneurs optimize their ADD and to perform better. He also has ADD, so of course this is going to be a fun conversation. We channel lots of different ways, but if you're somebody that's looking like, how do I focus better, and how do I concentrate and schedule my days, and what are some of the best methods to do this, Dr. LeGrand is an expert at exactly this at the highest level of people performing at the highest level. So you're going to get a lot out of this no matter who you are in terms of how to approach your day and your life, optimizations, whether you have ADD or not, because this is what he does day in and day out, and I'm very excited to share this. So without any more chat, let's dive in. Dr. LeGrand, welcome.
Hey, thanks
Pleasure
for having me.
to have you, man.
Yeah, thanks for having me.
So, we can go through a lot of topics. I want to start with maybe a unique perspective.
Yeah.
You talk a lot about ADHD,
Yeah.
which obviously is not unique to you or your brand.
Yeah.
But I think a lot of people get caught up on this topic in many different ways, right? Some people say, this is the stupidest thing ever. You're not ADHD. You're just overstimulated. Some people say, you're ridiculous. Like, this is an actual thing. And if you've never lived the experience, you can't talk about it.
Right.
And then people say the only way to solve it is drugs that make you focus, that can turn those centers off in the brain. Other people say there's definitely natural ways, which I know you talk about, to get to that point. How do you kind of bridge that gap? And I know your perspective, but like maybe bridge the gap for people? To get to a nice...
We have those two extremes, basically.
How do we get to a nice equilibrium where we can all respect where we're coming from, and then maybe dive into the topic a little bit deeper?
Yeah, for sure. So, I mean, I think to your first point is that, for those who people think like ADHD doesn't exist and those that say that do, and then of course we'll get into diving deep about the whole medication stuff. But to me, I could care less about the ADHD diagnosis.
Yeah.
To me, it's about trying to solve the problem and the symptoms that you're experiencing with that, and getting more to the root of the problem, like why you're having focus issues, why are you having brain fog, why aren't you motivated, why aren't you driven, why are you not being productive, or also the anxiety, like all those things. To me, I want to understand more of that, and whether you believe ADHD exists or not, those things are still real. Yeah. And to set this record straight, I think, yes, ADHD does exist. I have ADHD, but it's more about understanding that concept of like, those symptoms are real, that people are experiencing it. And some people don't want to admit they have the problem, but that's okay, because how can we solve the issues that you're experiencing symptom-wise and make your life better? And so tackling it from that angle, because the diagnosis itself doesn't really solve the problem. Like when I got diagnosed with ADHD, back in college when I was initially diagnosed, it didn't really, I didn't learn much more about myself. Growing up, I knew I had ADHD. Like my parents told me I did, but they never actually had me get officially diagnosed until I went in college. Because it was okay, take this prescription. Right. But I didn't and it wasn't really solving the problem. Like sure, it helped me be able to just focus more, but I didn't like the side effects of it. I felt like a complete zombie. I wasn't myself on it, and so I knew I had to look for a different avenue to solving this problem. And that kind of led into my journey to finding out what are some other doctors that can look at this at a different angle. Yeah. And that's when I found more holistic mind doctors that understood the importance of looking at the current symptoms I was experiencing, which was, I wasn't doing well in school. I couldn't focus. I had high test anxiety, stress. I also was dealing with low energy, was not focused or motivated or driven, so therefore I needed to get this solved, and they looked more at the root of the problem and found a lot of imbalances in my body chemistry. And once they did that, that helped just optimize of my ADHD. I always say this, I don't cure ADHD, and it's not something that's cured, but I like to optimize the ADHD brain. Yeah. How can we actually optimize the ADHD brain to its fullest capacity versus thinking that we have to get rid of ADHD, because I still have ADHD and I don't want to get rid of it. It's a part of who I am. It's things that it allows me to do because I have it optimized now. That makes us different and unique. So
to go down that train just a little bit more.
Yeah.
The nature of saying I have
a diagnosis like ADHD or any other disease.
Sure.
Some pockets of people would say, well, why even label yourself that way? It's just your brain wired differently, and it has advantages and disadvantages. Yeah. How do you look at that? Because you have obviously said I have it, and I'd love your opinion on why not just say, look, guys, my brain just works differently. Everyone works a little bit differently, and I use that to my advantage in certain scenarios that you can, but you have advantages. So I'd love to unpack that a little bit. Is it easier for you to message the way that you do because then somebody can resonate with that, or
so I mean, like kind of go more of like what has ADHD kind of done for me. So like where it's kind of more for me, definitely the creative aspect. I definitely think outside the box drastically. I tend to be a big risk taker than most people, and how that's benefited me, especially like in my own business, is to do things that I know others don't. They kind of don't move forward. But ADHD people will tend to do that because of impulse, right? So we, as kids, were impulsive. I was very impulsive in doing things like that. But applying it to business, and they've done surveys on this, where actually like about 70% of entrepreneurs either have ADHD or they have symptoms of ADHD where they were just undiagnosed, because there's a lot of adults that are undiagnosed with ADHD. And so it's fascinating to think about that. It's like, wow, 70% has that, and there's a lot of successful entrepreneurs, and there's a reason why, but they're not good at everything. When it comes to detail stuff, I suck at that. Like as far as like dealing with a lot of like things that require a detailed attention, that's not my strong suit. But when it comes to like implementing something like quickly, like I'm a quick starter to get something going, and then I find the right people to kind of like implement it. So, and a lot of entrepreneurs that way, and they could be another great skills like being visionary. But sometimes, with people with ADHD, they can get distracted with lots of different things. So what I've been able to do is to be able to help me focus more, hyper-focus on the important things, to execute better. And that's where successful ADHD entrepreneurs come in, is they have actually fine-tuned that skill for them. That's why they became successful, because they're utilizing their ADHD to become a successful person. Versus it being a disadvantage for them. Now, what's the opposite of disadvantage? Become very unfocused. You have 10 different business ideas or 10 different things that you're doing, and you're all over the place. And then also your marriage is in shambles, and relationships and all sorts of things, because you're all over the place. Because now that's where there's a lot of these symptoms, and usually that comes a lot to lifestyle, health, things that you have not paid attention to and let it just go off hinges, and that's where the symptoms creep in. So
makes sense. In nature, and I think this is along the lines of what you're saying. Most things are not good or bad. It's a spectrum of how you see it, and you have certain capabilities. Like you can be more into something, more intense with it. You can be more excited than most people, right? And so for the amount of effort that you're going to put towards something is just naturally going to be more than somebody else, and therefore the amount of output in that area is probably going to be just iterations X amount more than in somebody else. And I think that alone has always yielded results, right? Like anybody that's tried hard at anything in an exciting manner, like cringeworthy hard almost. In the beginning, people are like, oh, that's so cringeworthy. But then it's like after 3 months, they're like, man, you really got good at that, right? And it's like the expectation of being good at something in the beginning without a lot of effort is undeniably a false pretense, right?
Right, exactly.
So I really like that perspective. You obviously became a practitioner, somebody that helps other people. You use your superpowers. Can you give me some examples of how you're using your superpowers to help patients?
Some things, like especially since I specialize helping adults with ADHD and entrepreneurs that have ADHD symptoms or have focus and productivity issues. What I think one of the biggest things, kind of like what I was saying in my own personal story, I've implemented that. What I do now with patients is really looking at the root of the problem, is instead of looking at, as anybody who's gotten diagnosed with ADHD, is that it's just a questionnaire. And that doesn't give you very much information other than, okay, you got ADHD. Well, you're filling out this questionnaire. As you're filling it out, it's like, well, yeah, I know I can't focus multiple times a day. I'm not paying attention. I also interrupt people. Like, I already know these things, and you're just saying yes to these things, the things you already know. And as you're tallying it up, and they say, yeah, okay, you got ADHD. And that's how it was. Back when I got diagnosed, it was on a computer, and then you have a psychologist assessing it, and then they're like, yep, okay, you got ADHD. But that doesn't help me give a roadmap of really how to solve the problem other than take a medication. So for me, when I actually had doctors that were looking at different markers of deficiencies that I had, such as like my cortisol being plummeted and like why I had low energy, no wonder I couldn't focus throughout the day, where other different amino acids that were way off that had to be rebalanced. My digestive system was, I also had irritable bowel syndrome, and that the gut and brain are very interconnected, and that was also impacting having lots of brain fog, not focusing, impacting my stress and stuff like that. And so that's something I now do with my patients is, when someone comes to see me, I like to look at the body as a whole, because even if they have other medical issues, such as they might have diabetes, right? So blood sugars can definitely impact not only someone's energy, but it also can pick their focus throughout the day. And so it isn't just looking at the ADHD problem, but what are the other medical issues that are contributing to making the ADHD symptoms even worse? Because if we can tackle that, because the problem is when doctors are treating ADHD, they're just thinking of just the diagnosis. So they're just thinking of the brain. But it's more than just the brain, because everything's connected and can make things worse. And if you're just only tackling the brain, but what if it's something to do with your gut? What if it has to do something with your diabetes or thyroid, hormones? That could be making it worse, and you're not solving that problem. Then you can't ever solve it, right? So everything has to be kind of addressed, and that's kind of the unique angle that I tackle. And I think, because going back to your question, is how has my ADHD kind of helped that? And I think it's just because of thinking outside the box. I was talking about that. That's something that I would say is a superpower that some people with ADHD have, is they think out creatively outside the box. And so when I was trying to treat my own ADHD and solving this and getting help from other doctors, piecing this all together, like, all people who have ADHD need to be addressing this way, because it just makes sense to look at it from that perspective instead of just thinking it's just all just a brain or a dopamine issue, which is not. There's multiple reasons of why your ADHD could be off. And it's not the same for every person. That's the other thing. It kind of comes down to an individual needed basis, because not everyone has diabetes with ADHD, but they might also have a thyroid issue, or they might have, like I said, like digestive issues. So it just depends on what their other medical history kind of brings. And that's kind of the unique angle that I take that other people probably don't when they've been treated with their ADHD, because a lot of times there's only two things that really in the medical industry that they use for specifically treating ADHD, which is medication and cognitive behavioral therapy.
Yeah.
Right? That's pretty much, when you look at just textbook examples, like even when I was in medical school, like that's pretty much this all was really addressed, which is unfortunate, because if you look at all the other kind of medical issues, we've advanced more, but when it comes to mental health, especially ADHD, it hasn't really advanced at all.
Yeah.
As far as treating it. I mean, it has, but not in the main medical industry. Other people have had to look at other resources, and there's great companies that have implemented things, things like even like neurofeedback that has helped a lot with ADHD as well. But I take it at a very unique angle, because I feel like, especially because I specialize with adults with ADHD, it's very different. Not like very different, but there's definitely, it's treating a different problem than a child with ADHD. There's a lot of similarities, but adults tend to have a lot more package of a lot more other health issues that have to be solved before we can start unpackaging their other ADHD symptoms, because it's kind of overarching, right? Because if you have all these other health issues, it makes it difficult to treat the ADHD. Does that make sense?
Yeah.
So we have to unpackage that, and once we can kind of solve that, then we can kind of tackle more of the ADHD issues, which might be some different amino acids that might be out of balance, or micronutrient deficiencies that could be out of balance that help make things like dopamine, make things that they might be deficient, why they can't be motivated or focused and driven. So it just really kind of depends there.
You mentioned something really interesting.
Yeah.
In kids, you were saying hey, look, they have all these other issues we have to address before we can get to the brain. Mm-hmm. Is there a lot of scenarios where when you address those issues, the problem goes away? Because what I'm trying to get at is, are all these kids actually ADHD? Like, or is it the fact that their bodies are such a mess? How can their brain possibly be functioning properly?
Right. So this is, it's a very unique question because there's a lot that's been going on over the past several years. Why have we seen an increase in diagnoses with kids with ADHD? But I'd say even more so we've seen an increase in adult diagnoses because it's late diagnosis when you're getting diagnosed with as an adult. And that happened a lot with the pandemic. People being at home and their spouse or significant others like, hey, I think you got ADHD, I gotta get checked in. And so now we're dealing with people who, one, getting seen to be treated. Some people have to wait several months before they can even be checked in. I've even heard sometimes like a couple of years in certain countries.
Yep.
That's a problem. And then there's a shortage of the only source that the medical industry will use for treatment is medication. And we've dealt with lots of shortages of that. And that's where I see a lot of people will come see me because what are they supposed to do? You know what they tell them? It's like, go meditate. That's their suggestion, is go get some therapy and meditate. Good luck to you. Sorry, there's no supply of any medication.
Yeah.
And they're left to their own devices. And they're like, well, you just put me on this. Now they're going through withdrawal effects. That's even worse. It's like, so, I mean, I know I'm circling back here as far as like your question on, is it really that more people are getting ADHD issues? I think so. Mainly because of the toxic environments we have. We have the food that we eat. As far as we understand, as far as ADHD, it has to be something that you're more born with. It isn't like something you develop. That, like when you get diagnosed with ADHD as an adult, you actually, in order to get diagnosed with someone as an adult, you have to have the same symptoms. You have to like recall if you have the same symptoms as a child. If those don't exist, they're like, oh no, I didn't have these issues as a child, then it's not ADHD. It's probably, could be early time set of dementia or just other medical issues, but it isn't usually ADHD. So if someone's diagnosing you that's correctly as an adult, they usually will assess if you had those issues as a child. So now why we're seeing an increase in child, it's a lot of times kind of the environment. It all starts with in the womb, right? So it could be a possibility of a lot of the toxic environments that we're experiencing in our environment. The foods that we eat becomes more of an issue. Now, obviously there's an increase when it comes to parents, right? If a parent has it, there's a higher increase likely chance. If both parents have it, even more so. So it's also more inherited. And so it's just increasing more and more. So there's multiple factors.
Yeah.
Now it's hard to kind of gather all that data, and I've seen some research and data and stuff like that to like know specifically which one's increasing it. It's just all together. It's just starting to just increase amount of the diagnoses.
Through your work, have you seen lots of reversals of, hey, this person's brain was messed up, and I know we'll get into your practice. Yeah. But it's like, hey, if we remove the toxins from, let's just call the examples, call out the examples you had. We'll remove the toxins from the environment. We'll optimize the diet. We'll put them in a better spot. I know we haven't talked about, the way apps and technology is today.
Yeah, no, that's another thing that we didn't even get to. But
right. But I'm just gonna call it out now. So I'm just gonna like touch on all the things that probably people think about or heard.
Right.
But essentially, let's start with, have you been able to go, okay, we're working with this kid and he was absolutely terrible at concentration, and all of a sudden, like, we've had a turnaround?
So, I mean, I don't, like I said before, I work with just adults. I mean, I have worked with kids in the past, but, I have seen even with kids, but even with adults, yes, been able to essentially get where the symptoms have pretty much diminished or even get rid of mostly completely. Now,
amazing.
Even for me, like even with me treating my own ADHD, I still have my ADHD moments, but it's okay. Was it before? No, not even close. So, the thing is, with people with ADHD, they have to, once they start treating it and they get the results, they have to be consistent. You have to actually live a different lifestyle. You really do. You can't just go back to your old kind of habits and things. And depending on what it was it environment, was it things you're eating? Because all those things can make your ADHD worse. Like I said, I don't cure it because I don't think it's not something that is cured, but can we optimize it where it's even better and get rid of the symptoms? Yes, we can. And I've been able to successfully seen that happen multiple times. And especially with adults that we do work with and entrepreneurs that we work with that struggle with having focused productivity throughout the day and being motivated and driven, those things are the things that definitely make a huge difference in their life because they were able to, one, understand why by doing some lab testing, understand and identify why is that the problem, and then, oh, wow, yeah, I clearly have things that are completely deficient, or there's certain hormones that are way elevated, like making me high stress, and now I can't focus, and it could be a number of different things, and so we balance that out, but then you have to convert that into lifestyle and be consistent with it, and that's the thing that we kind of help try to tweak, is to be able to make it work with your lifestyle so you can be consistent with it, because if you're on a treatment plan that you know you can't be consistent with, then it makes it very difficult, and then it's defeating the purpose, because the whole purpose is having it where you can be consistent with it so you can live with your ADHD and be successful with your ADHD. Yeah.
Got it. That's actually a good bridge to, you just talked about, this is the results that we get. Yeah. Talk me through, you sign up a patient or a patient comes to you.
Yeah.
What's your methodology around, all right, let's explore what's really going on here. Let's unpack what's going on, right? Like, how do we meet that person where they are? I'd love to learn a little bit more.
Yeah, for sure.
And I think the listeners would love to learn, like, how does Dr. LeGrand approach a patient, and what does that journey look like?
Yeah, for sure. So, like, usually when someone's coming in, an adult, everyone's going to have different reasons that their ADHD is impacting them. It might be that they might lose their job because their productivity has gone really down and their boss is on them, and they're not focused. Or it could be it's impacting their relationships or marriage. It could be that they aren't enjoying life because they aren't motivated or driven to do anything in life, and they just want to enjoy life again. So it depends on, like, obviously the reason, and it's going to be different. But usually with every person, when we kind of identify, okay, what is the symptoms that they're experiencing and how it's impacting their life, is now the first step is really to, like I was saying before, is to investigate, right? Mm-hmm. So it comes down to investigation, is to identify through lab testing to see what numbers. So if we want to talk about specific kind of labs, I mean, it depends on, but I was giving a few examples here. Is like we might need to look into hormones, especially for adults. And why hormones? Because hormones definitely impact the brain drastically. It definitely impacts someone's energy, and a lot of adults with ADHD tend to reach this mental and physical burnout stage. That's kind of a big difference between adults and kids. Kids, usually a lot of parents are complaining that they're too high energy. When it's adults, it kind of shifts. Even for me, in early college years, I was starting to weirdly hit this kind of low energy stage when I was a kid, very high energy. And so it kind of changed that when we shift in to being adults. And so that's just like kind of one aspect. The other thing I mentioned, is looking at specifically micronutrient deficiencies that could be off, looking at different vitamins, minerals, amino acids, antioxidants, that if they're deficient, it could be those one things, not to get too sciencey here, but like they could be certain cofactors that actually do help make dopamine. So example would be vitamin B6. Vitamin B6 is an important cofactor, the activated form of vitamin B6 actually, to making dopamine. Now, if that is deficient, it's going to be very difficult to make enough dopamine, and therefore if you're not having dopamine, that's going to decrease your motivation, drive, and focus, so that could be an issue. It could be a different amino acid, like something like phenylalanine. This important acid that actually makes tyrosine. Tyrosine makes L-dopa, and then L-dopa makes dopamine. So it could be that. It could be a number of different things. Mm-hmm. But the important thing is the first step is actually to test. So once we've tested, then we can look at all these different things and see now what we need to address it. We might use some supplementation, use certain supplements at a high dose, because they've been so deficient for so long. But the point of the supplementation is like a stepping stone. It isn't like the cure. It definitely helps a lot, don't get me wrong. But the reason why I don't say it's the cure is because it gets things going and you're going to feel good on it because you've been so deficient for so long, but you need to start replacing that with the right foods. Because remember I was talking about consistency and having consistency through your life. A lot of people with ADHD just want to feel normal and have consistency of focus. They don't necessarily need to have like the most amazing optimized brain. I mean, certainly, you know, we can get to that point, but like they just want to first get to consistency and they don't have to feel like they hit these crashes all the time. And so when we implement the right foods and nutrients that they were deficient on, because now we've done lab testing, and now we're replacing the supplementation and because they're implementing good habits, but they know what to target versus just going at it completely blindly. And then from there, you know, there's still a huge component is internal and external stressors. And so what I mean by internal and external stressors, so internal stressors are going to be things, yes, that we consume that are bad. Also the environment, the air that we breathe, that are bad. Can we start eliminating that? You know, what if there's mold in your house? Well, that does affect the neurological system drastically. So if that is present, that's what I mean is like if you're breathing that, we got to remove that thing that's happening internally. Now, what I mean by external, that's usually external environment where you may or may not have control of, but a lot of times you do. So that means like bad relationships. Are these bad relationships, are they toxic and causing you more stress? And why does that impact ADHD? Because mental health in general all feed off of each other. Anxiety, depression, ADHD, even, you know, bipolar disorder, psychosis, like a lot of them really do feed into each other. And stress is a huge component to that. And so if you are in a toxic relationship that's constantly causing you high stress, it's not going to help you be focused. You're going to be very distracted, unmotivated, unhappy, lack of motivation and depression. And so you have to ask yourself, should I get rid of this relationship? Is it really healthy for me? Or can I resolve or fix this relationship? That should be your number one priority on your ADHD, is trying to resolve that. Now, if it's not unfixable and resolvable, you do have to ask yourself if it's even good for you and you should be getting rid of it altogether. Yeah. Same with work environment, right? If the work environment is toxic and it's causing your situation to be worse, where it's causing you a lot more stress, do we need to get rid of that? So there's a lot of examples as far as when it comes to external, but those are things that I usually will ask my patients those questions. Those are hard questions, but it will service them better if they're able to remove those toxic, you know, external stressors in their life, whether it's work and relationships or whatever, because now the body can heal. So they can be implementing all these good things, whether that's supplements or good foods, good exercise. I mean, we haven't talked about exercise, like that's another big thing, you know, but like, you know, all these different treatment plans, it's not going to do anything if you have all these stressors, internal, externals. It's just like, it's a roadblock, you know, because the body's not going to heal. But once you eliminate those stressors, the body now has the capacity to heal itself. And I've seen it multiple times again. It's like where I find a patient that they're having a hard time healing, they're implementing all the good things, and I'm finding out there's all these different stressors in their life. It's like, dude, we got to eliminate these. And once we eliminate them, all of a sudden they finally get better. Yeah. Because it's so hard to heal when you have those stressors, and people have to really take this seriously. And it is hard. Like when you have to ask yourself, do I need to get rid of a relationship that I've been in for a long time? And it might not just be like, you know, a romantic relationship or anything. It could be family, you know. Maybe you don't necessarily, maybe you just cut off from you maybe being amongst that certain family member because it's just causing you so much stress. You just have to, you know, you have to ask yourself. There's also toxic things that people do, especially people with ADHD. They might say yes to a lot of things, but I always ask my patients, like, whenever you say yes, you have to ask yourself, what are you saying no to? Because are you saying no to your health? Are you saying no to your family? Are you saying no to your job? Or like things that are, you know, providing food on the table? Like, you know, you have to ask yourself, what are you saying yes to? Because anytime you say yes, you're always going to say no to something. Yeah. And you have to ask yourself that itself. And then you put yourself in this very stressful environment again because you constantly are saying yes to things. Yeah. When it just makes your life just more stressful. So those are kind of like some examples. It's like, I mean, there's a lot, you know, that we have to unpack and everyone's going to be unique what they want to accomplish. But those are kind of like the structure of like how we help people treating with their ADHD in that capacity.
Awesome.
Yeah.
So thank you for sharing that.
Yeah.
I think you impact a lot of things. And just like kind of going over them to recoup a little bit, external, internal stressors, diet, relationships. Out of all those things, is there one of those factors that's more common than others in patients that you're seeing? Like, is there a pattern of, hey, we're really seeing relationships be an issue here, or like the people to hang out, or is it, man, you're really putting yourself in a shitty situation, whether that's at home or at work, where you're not able to thrive, or is it you just make terrible food choices? Is there one that's more common, or are you feeling
I'd say it's
like
lifestyle more than anything. Like, honestly, as simple, and it's not fancy, but like, honestly, if someone truly asks themselves that, am I really eating what I need to be eating?
Yeah.
Am I really exercising that I should be? Because there's 5 like big things that I always say, like pillars. That's getting good nutrition in consistently. And most people with ADHD, one of the big problems that they have is typically just not getting enough protein in on a regular basis. Now, why protein is so important is because it has a lot of amino acids. A lot of those amino acids actually make dopamine, and they make other important hormones and other neurotransmitters that are important for us people with ADHD need. So they're not getting that. They're not keeping themselves hydrated. Why is hydration really important? Well, the brain is 70% water, and so it's like in the body, and so keeping yourself hydrated is really important. Exercise. Why is that important? Because there's a lot of different hormones in circulation and blood flow in circulation that's important that can become stagnant, and it can cause issues of brain fog and focus issues if you're not doing that. And that can be a consistent thing that I know I always have to work on, is getting always exercise in, because anytime I don't, that becomes an issue. Sleep is another huge one, which we actually have not talked about. That definitely can impact ADHD drastically, because if you're not getting good sleep, and this is where they've seen it also with kids. So a lot of times, a lot of kids with ADHD, they're just not getting good sleep. And if you're like starting to solve that problem, you'll start seeing ADHD symptoms improve. And then we already talked about internal and external stressors. But I think you're coming down to like, what is the one thing? It's kind of hard to say, but like if I really had to think about it, it's like, really is like lifestyle. So it's like, if like people just like dial in those 5 things, but like if they even just had to just only pick one, I guess, if you want to like calm down, just start eating better. See what happens.
So diet.
Start cleaning up, because just start cleaning up, because why is that important? Because I talked about all this, advancing testing. Now testing, yes, it's important because it can help identify, but if you want to just start somewhere, is just start really cleaning up diet and actually take it seriously, but not doing extreme dieting, not like going completely vegetarian, because you might be missing very vital amino acids, so that just doesn't really help the ADHD situation. But getting a good, well-balanced diet that has clean protein in your diet, lots of vegetables into your diet, healthy, fats into your diet. People with ADHD don't have an issue with carbs, but getting clean, not clean, but more complex carbs.
Yeah.
Healthy complex carbs and starches into your diet, and you start doing that on a regular basis, you will start seeing improvements in your ADHD. Now, you might be someone who's watching this and be like, well, I've already been doing that. And this is where you want to do lab testing. So like if you're in that situation and you've already done eating clean and you've done all these things, and you're exercising regularly, and you're hydrating yourself, and you're also sleeping really good, I'll probably debate you probably have at least one of the 5 is probably the internal external stressors. That's probably something that's not working, but if you have all those other 4, you probably should do some lab testing to really see what are you missing. Yeah. There's probably some nutrient component that is missing. That's where lab testing can become really handy. So
gotcha.
Yeah.
So definitely hear you, and I was trying to say, is there a pattern of things that would help? And it sounds like it's diet would be the biggest lever in terms of like, most people just need to clean that up regardless.
Everyone has to clean it up, honestly. And then obviously removing, in naturopathic medicine, we always talk about this, like removing remove the obstacles that are causing the problem. And usually it's going to be removing the toxic things that we're consuming, and also removing the toxic environment we're breathing and all that kind of stuff. And then we add. Right? Then we're adding the good foods and all that kind of stuff. So because if you don't remove the toxic stuff, so like let's say, okay, I'm cleaning up my diet, but I'm eating something very toxic for me, then, I mean, there's improvement, but then there's still issues. Or you're breathing toxic air, like let's say it is mold or something like that, and you're eating good, but there's something in the environment that's still causing the problem.
Sure.
So we need to identify what do we need to remove first. So I'd say that is the very first step, is removing things that need to be removed.
Yeah.
And then, but yes, I know it's a very difficult question to answer as far as what is one thing, but it really I think the big one is definitely, if someone had to just take one thing, is just like cleaning up the diet.
Yeah.
Cleaning up the foods that you should be consuming.
And to clarify, I wasn't saying it was the one thing that
Okay.
everybody should do.
Yeah.
I was trying to more extrapolate from you.
Yeah.
Is there a common denominator that everybody that you're seeing has, like, and it was more to say, like, in the common day, if this is what you're experiencing, maybe this is where we need to look first, whether you're working with Dr. LeGrand or not, right?
Yeah.
It's like, everyone's diet's terrible, so it's like, at the very least, if you change that, we know that there's some impact. It could be the wrong thing, right? And if we don't go, but I think a lot of people just don't know where to even start today, right? It's like, oh, there's this new diet every month that everyone's, these influencers are talking about it.
I'm not a big fan.
Yeah,
I'm not a big fan of diets. I think people with ADHD just need to have more balanced diet of all the macronutrients that are important that I just listed. Fats, healthy fats. Protein's a huge one, I would say. So if I had to pick a macronutrient, put your focus on just protein.
Yeah.
Just start increasing your healthy protein. Healthy protein. Incorporating more of that in your diet, you'll start to see improvements in your ADHD. And a lot of people with ADHD who don't even, I've seen that, people, will do the carnivore diet and they see a drastic improvement. Now, is that sustainable? For a lot of people, that is sustainable. That's why I don't like, per se, diets. But just improve your protein. Just improve that and see how that actually improves things, and you will see improvements. But if you feel like it isn't improving to the level that you want, then that's when you start going in more advanced and you start looking at lab testing to see really what is the problem. How could I optimize it even more? And that's where investigative work, it comes in handy.
And to your point, like, all the things that we're talking about, they're realistically tools that should be used at points in time.
Right.
But then everybody over-indexes on doing it forever, and then they're like, "This is the best thing ever," and it's like, sure, but and then after a year, they're like, "Well, my labs don't look good," and you're like, "That's because the intervention worked, and now it's not working anymore, right?" And this is where most people don't have somebody in their corner to be like you, to be like, "This is what we're doing. This is the game plan. Here's why. I know how to read these labs. You don't." It's like, and then the coaching part of it, like notoriously people are just terrible at self-diagnosing and doing the right thing. For many different reasons, which we can get into maybe another podcast. But I think we went a lot into some of this nitty-gritty stuff. I'm going to pull us back just for some of the last kind of conversation pieces. If you're somebody that's like, I don't know, I don't feel well, I don't know who to work with, what would be your advice? Whether you have ADHD or not, or whether you think you have it, what would be your advice in terms of, like, how would Dr. LeGrand, if you were in their shoes, how would you approach working with somebody or looking for a solution?
Yeah, so I mean, honestly, like, we work virtually. So like, if people are looking for somebody, that's what we do. If you're an adult with ADHD, looking to solve it, or let's say you don't have the diagnosis, because I can care less if you have the diagnosis or not, but you're having issues with focus, motivation, drive. Maybe you're an entrepreneur that are struggling being productive within your business, and you're running a huge team, and you're like, man, I just can't. I keep on just fumbling. I can't. I keep on getting brain fog. I'm completely burnt out and then just exhausted. So I mean, you could check us out. I'm on YouTube a lot. Dr. LeGrand. You could find me there. Usually if you go into the descriptions, you could find a way. You could book a consultation with us through there. And also, but like, let's say, I mean, you don't have to work with us, but like, where you need to go is looking for at least a functional medicine doctor that understands at least the capacity of doing functional lab testing to dive deeper into the root of the problem. Better if they can understand more about brain health and ADHD, even better, instead of just going to your conventional doctor, because everybody's already been doing that and hasn't been working for them. And it's not to their own fault, it's just different training. And so like their job is to make sure that you don't die. Their job isn't to optimize.
Still an important job.
It is a very important job.
Yeah.
So that's, I think if we actually understood like, you know, what every doctor's role is, and insurance and in the, you know, medical industry, like they're very good at keeping us alive so that we don't die. But when it comes to optimization and prevention, that's just not in their training, and that's not to their fault, and that's okay. And that's where functional medicine comes in and can really benefit to understand where can we actually optimize your brain and get rid of the ADHD symptoms so that you can excel being a great business owner, or excel just having better relationships, or if you're at work, in a work environment, to be a better employee, whatever that is. That's something that we could definitely help you out there, or I would at least look into some functional medicine doctor.
Amazing.
Yeah.
Last question.
Yeah.
What does Dr. LeGrand do when he needs to focus?
What do I need to do to focus? Or like
what do you do when you need to focus?
Oh, like for me?
Yeah.
Like what I do personally when I need to focus. So like,
yeah, like say you're like, I need deep work. What am I doing?
Yeah, what am I doing? So I guess if we want to talk about hacks, like a current one that I really like, what I've been doing recently is, since I do a lot of things virtually now, I tend to also walk a lot now. Mm-hmm. And I do it while I work. I'll take calls, I'll meet with my team, I will you know, even meet with my patients sometimes that way, or brainstorm, because I mentioned exercise is a really important thing. And that's helped me out immensely. I'm at a point where I don't really necessarily need to be taking much supplements at all. I kind of go through seasons. Mm-hmm. So a lot of people ask me a lot about supplements. I do talk a lot about supplements on my channel because it's a good, like I said, starting point.
Yeah.
But I don't have to rely really much on supplements. I will experiment with ones, and get benefits. But I'm at a point where, like I said, I got more of those 5 things more dialed down in. Am I perfect at it? No. You know, I go through seasons. Usually winter times are usually tougher times because of holidays come in. Yeah. So I usually have to clean up my diet more afterwards. But currently I like the walking. As simple as that is, I've found that very effective to keep me focused and get a lot of work done. But yeah.
Amazing. Yeah. Dr. LeGrand, we're going to link
to
your YouTube, to your site, and all of that, because you already mentioned it. I was going to ask.
Okay.
But it was an absolute pleasure having you, and thanks for sharing A, your story, B, how people can help themselves, and C, how they can get help.
Yeah. Well, thank you. Thanks for having me.